Thank you, Joe, and thank you for the opportunity to participate today. It was really inspiring to hear the remarks of Dr. Drake, and I was particularly intrigued to learn about some of the newer recovery interventions, both in this country and abroad. It gives me a lot of hope. With respect to the question you posed, Joe, I think that there are obviously many benefits to a recovery-oriented system of care. And so I won't spend much time on that. What I'd like to focus on, though, are some of the challenges that I see in building such a system. So I'd like to start out by saying that recovery system development is well underway in the state of Missouri. We have a strong and active recovery network. We have some 879 active certified peer specialists in the state. There are 1,200 accredited recovery housing beds in Missouri. We have some 53 recovery support providers and 4 recovery community centers that offer a great deal of peer support. So we're off to a good start. However, in a state with a population of 6.1 million people and a mental health department that is supporting services for approximately 170,000 individuals annually, there is room, indeed, there is a need for growth. So aside from funding, which we know is probably the biggest challenge, a couple of others come to mind as we strive to grow the system. One is adopting the core values of a well-designed system. Many practitioners find it difficult to partner with people, their families, and advocates to develop, implement, manage, monitor, and evaluate systems. That is simply not the way we've traditionally done this work, and making the shift is difficult for many. Another is embracing cultural diversity. In a city like St. Louis, for example, we have a very diverse population. And so it's very important for providers to ensure that their staff understand the cultural diversity that exists in the community and prepare themselves to be able to work with all people that are likely to show up at their doors. Collaborating across agencies and service systems. We do not do a very good job of that in Missouri. There's some collaboration, but particularly across systems, it's very challenging. We don't share enough information. We don't seek out our partners in other agencies sufficiently and learn from each other and plan together. And something else that I observe frequently is the use of stigmatizing language. We have to get away from that. We have to abandon it. More providers also need to figure out how to address the broader range of support needed for people seeking different pathways to recovery. We can also do a better job of empowering individuals to tell us what will help them get better. We should grow and strengthen the peer workforce, allowing these experts with recovery experience to play a bigger role in the system of care. Another challenge I see is fully embracing some of the key elements of person-centered care. For example, welcoming entry into the system at any time, regardless of prior treatment or that individual's history in treatment. Reliance on global assessment rather than a problem-focused approach as we work with individuals. Greater respect for individual choice. Individuals we serve should have a much greater voice in the services they choose, the way they will receive services, and the way they'll participate in our programming. And finally, we should build on the strengths of the individual, family, and community. These are some of the challenges that I've observed over time. We are getting better, but we have a long way to go. And that's why I'm so excited about having the Center of Excellence here in St. Louis, where all of our providers, as well as consumers and their family members, have the opportunity to access high quality information that will help all of us to do a better job going forward.